Hello, North Dakota. Thanks for tuning into our afternoon briefing. Yesterday, we had a lighter day because of all the positive news. Today, I'm sad to start off our report reporting that we've had our 5th death in the state of North Dakota related to COVID-19. This individual was a male in his 60s from Stark County. He did have underlying health conditions, acquired COVID-19 through community spread. And our hearts and prayers, of course, go out to his family and friends and all of his loved ones who are dealing with this loss. Also, and that'll be shown in today's numbers as our 5th deaths, but we've also become aware just in recent hours that there was a second COVID-related death earlier today, but no details are available this time, pending notification of relatives. So those will be in tomorrow's report. This will bump up to 6 tomorrow. But again, our deepest condolences on behalf of the First Lady and myself to family members and friends and communities who've lost a loved one. We know that that's really what all this has been about, is trying to make decisions pragmatically using data, but leading with our heart to make sure that we're protecting ourselves against this invisible assailant, which has such a deadly effect on elderly and people with underlying health conditions. And so that's why we take our work seriously in terms of what we're doing and why we're weighing every decision carefully. But as we take a look at the other numbers today, there's also some positive news on that slide, and that's down in the center, middle center. I want to draw your attention to that, which is 14 hospitalizations. This is the net, so there's 2 more discharges. So the good news is 2 people that were hospitalized with COVID so that number's gone down, and I want to say that for those that are worried about, are we prepared enough? The key of all the things that we're doing and what every state is doing is trying to make sure that the sum total of all of the business closures and physical distancing and great hygiene practices, all of the new approaches to how we're conducting business, all of that is done with the goal of preserving to make sure that you have enough hospital capacity to give the highest level of care, and that could mean in a life-threatening situation that you can get somebody into intensive care unit or ICU, that you've got those care units available. And so from that standpoint, even though we're saddened by the news of 2 more deaths, I want North Dakotans to know and understand that with 14 people hospitalized, and again, continuing to really refine that number, but we know that number is in the thousands, that we are literally using less than 1% of the hospital capacity today for COVID patients. So that means 99% remains available. And so that's what we should focus on, because in terms of what we're working on to do, that is absolutely positively working. In terms of the rolling 7-day average, still at 3%. That's still among the top of all the states in terms of those tested versus those who are becoming positive. So that's fantastic. And then also in terms of recovered, we have a headline on that sense that we've now added 3 more people to the recovered column, which pushes our total to over 100 that are recovered. When we show that graphically on the next slide, again, on the top of this shows the active cases are above the line. So that's yesterday's active cases plus the new reported positives, and below the line is the recovereds and those people who've passed away. And again, yesterday we had great news because it was, you see a little dip there where we actually had more recovereds than we had new. Today we had more new than we had recovered. And so it continues to climb. Active cases climb by 14 today. That's the numbers for today.